Hi, knock knock. How are you?
Good, how are you?
I'm good. Let me just wash my hands. My name is Quynh. I'm going to be your nurse today. So what brings you into the clinic?
Just an exam.
Just an exam?
Mm-hmm.
Like just a general checkup,
Physical.
right?
Mm-hmm.
Okay. Well, since we've already finished everything in my perfect scenario, we're going to go on and move to the upper and lower extremities. So the first is I'm just going to ask you to remove your jacket, just so that I can better gauge your skin.
Okie dokie. Can I just leave it on like that?
Sure.
Okay.
So, it's kind of chilly out here, so I'm just going to allow her to have her jacket on. But just imagine that I'm able to see her skin, and I'm assessing for symmetry, skin integrity, color, texture, if there's any deformities or visible deformities or masses. And she looks like it's normal and intact. I'm then gonna assess her and start with the fingers. So I'm gonna assess for capillary refills and make sure that it's less than 2 seconds, which it is, so that's great. I'm gonna assess also for the radial pulses and make sure that they're also equal and they're also present, which they are. I'm then gonna feel for her fingers and make sure that I don't feel any crepitus, any deformities, any tenderness. And you just let me know if you feel any tenderness, okay?
Okay.
So I'm feeling her fingers and they're fine. You don't feel any tenderness,
Nope.
right? I'm feeling her wrist for the same thing. Any nodules, any crepitus, any deformities and masses, lesions. I'm also going to do the same for the elbows, and they're fine as well. And also the joints of the shoulders, which she doesn't reveal to have any tenderness as well. So now I'm going to move on to the range of motion, and we're going to start from the fingers. So I'm going to have her flex for me, yes, and extend, and also abduct and also adduct. Excellent. And I'm gonna ask her to do the same for her wrist. So if you can just flex for me and extend and hyperextend.
Sorry.
Excellent. And can you rotate it? I'm going to assess for radial deviation and also ulnar deviation, which is intact and negative. I'm going to also move on to the elbows now. So can I have you flex your elbows and extend your elbows, and then also hyper extend your elbows? Excellent. No problems with that either. Now we're going to move on to the shoulders, and I'm going to ask you to flex your shoulders, good, extend your shoulders, and hyperextend your shoulders. And what about internal rotation and external rotation and circumduct, and also the other way? Good. Give yourself a hug. This is adduction and also abduction, and everything is intact right there. We're now going to assess her for her strength. So I'm going to ask her to please grip my hands as hard as she can. Good. So her strength is equal in both arms, 5 out of 5. I'm also going to assess for biceps and tricep strength. So I'm going to ask her to go against resistance, which she does. And excellent. So same for your shoulders as well. Good. And resist against me. Very good. I'm now going to assess for any ulnar thing with
Ulnar.
a
Vibratory.
vibratory senses of the ulnar nerve. So, or yeah,
Ulnar.
the ulnar bone. So this is a tuning fork, my makeshift tuning fork. I'm gonna vibrate it, and I'm gonna put it right over the ulnar bone and ask if she can feel the sensation, which she does. And then the same for the other arm. And good, excellent. So you do feel it, right?
Yes.
Good, good, good. Now I'm gonna test for the reflexes. We're gonna start with the brachioradialis. So just relax your arm. Relax, relax. Good. Good. So now I'm gonna check for the biceps as well. So relax. Good. And then triceps. Good. So I did the same for the other arm, and that's normal and intact as well. So one last thing we're going to test is sensations and make sure that they're equal and present. So I'm going to ask you to let go of your, your sweater. So just let me know which side I'm touching, okay? So relax your arms. Which side am I touching?
Left.
And which side am I touching? Good. So now I'm gonna also draw something in your hands. Just let me know what you think I drew.
Okay.
So I'm going to draw a 1, but she doesn't know that.
1.
Good. And I'm also gonna draw an 8 on this side, but she doesn't know that.
8. Good.
Good. I'm also gonna put something in her hand and ask her to recognize that item. That's testing for stereognosis. So let me know what this
Phone.
is. Good. You're actually very quick with that. And one more.
Thank you.
One more.
Hammer.
It's a hammer. Good. She has passed for that. One more last thing is I'm going to ask you to open your eyes, and I'm going to check for cerebellar incoordination, or if there's any lesions there. So I'm going to have you touch my hand with your hand. Good. And the other side. Good. Now can you do your fingers opposition? Good. And put your fingers or hands on your lap. Flip it back and forth real fast. So she's coordinated. It's good. She doesn't have any cerebellar problems. So moving on, we're going to go to the lower extremities. So for the lower extremities, I am doing the same thing as I am doing for the upper extremities, in the sense that I'm looking just visually and assessing for any edema, the skin integrity, the color, the texture, any deformities, any visible masses, or if there's any amputations, missing limbs. So everything is normal and intact. So so can you please take off your shoes? She's such a great patient. So uncross your legs for me. Thank you, dear. So we're going to assess for the reflexes in the lower extremities. I'm going to check for the patellar reflexes. Good. So that's intact. I'm also going to check for the Achilles. So if I can have you switch in back. Very, very good. Good. So they're also all intact. Lastly, I'm going to check for the Babinski reflex. So I'm going to have you relax. Ooh, sorry. That was awfully close. So they're all intact in both feet. I'm now going to check for the pulses. So I'm going to check for the dorsalis pedis, or pedis, the dorsalis pedis. I'm also going to check for the posterior tibialis, and they're all intact and equal as well. In clinical setting, I might check for popliteal and also femoral, but not in this situation. Okay, so moving on, checking for her, or starting at her toes. So I'm checking for the same thing, capillary refills in each little toes to see if blood returns in less than 2 seconds, which it does. And I'm gonna ask her now to report any tenderness if she feels it. Any tenderness for you?
Nope.
No? Excellent. So I'm going to ask you to abduct your toes. Good. And adduct your toes if you can. Good. Can you also move it, flex it? Good. And can you extend it? Good. So everything is intact with both feet, right? Because we're doing both sides. And now I'm going to assess for her ankles. So I'm going to have her just do a plantar, plantar flexion, good, and then dorsi extension, right? Dorsiflex, good, and then I'm going to ask her to invert, good, and then exvert, excellent. And can you also rotate it? Excellent. So everything is intact there. I'm now going to move up to her knees. So she's already in a flexion state, so I know that she can flex. Can I have you extend? Good. And then hyperextend is all the way up. Good. Excellent. It's kind of typical sometimes. Now I'm going to move on to her hips. So I'm going to ask you to stand, please. Good. So I'm going to have you flex your hip. Good. And then I'm going to have you extend your hip. Good. Excellent. You can see there. I'm going to hold her for a little bit of balance. Can I have you abduct your hip? Good. And then adduct. Good. And then I'm going to have you internally rotate. And then external rotation. And then the ability to move it freely and about. Good. And she's able to do that in the other side of her hip as well. so that's excellent. I'm now going to assess for strength. And I'm going to start with her lower extremities. So I'm going to ask her to move against resistance. So I'm going to push down and her feet are going to go up. So push up, good. And then also other way, excellent. And I'm going to try her knees, good. And then other way, good. And then I'm going to assess for her hips. So I'm going to ask you to move out and in, and they are both present and intact. I'm also going to assess for her hips and the ability for that to feel sensations. So I'm going to have you close your eyes. Okay, so tell me which side I'm touching, okay?
Okay.
Both. Good. And one more time.
Left.
Excellent. And then one more on your feet. Tell me which side I'm touching.
Right.
Okay. And she's ticklish, which is very normal and to be expected. One last thing is I'm going to assess for the medial malleolus vibration. So tuning fork again. Do that and let me know if you can feel it, okay?
Okay.
So medial malleolus right here.
Feel it.
Awesome. And the same goes for the other foot, which she does report. So that does conclude the upper and lower extremities. Thank you so much for your time.
Thank you.
Good luck with everything.
Thank you. Bye.